I'm Suparna Damany. I'm from Allentown, Pennsylvania, and I've been specializing in chronic musculoskeletal pain syndromes for 20 years. And over the years, with a lot of trial and error, I've developed my own brand of treatment technique called the Damany Integrative Dynamic Approach. This technique is based on the philosophy that chronic pain syndromes are multifaceted, and that if you address only one part of the multifaceted pain puzzle, the results, the outcomes are not favorable. But if you treat every facet of this pain puzzle, then the results are amazing. And so today, I'm going to talk a little bit about the philosophy of chronic pain, and also the multiple facets and the interactions that go into chronic musculoskeletal pain syndromes, and then talk a little bit about my program, which is the Damany Integrative Dynamic Approach. Of course, this program is copyrighted. This entire presentation is copyrighted to me, and should not be disclosed or reproduced without prior written consent.
Well, I started having constant pain in my hands and my arms. I had been doing a lot of repetitive tasks at work and also at home, and it became to a point where I had pain all the time. I started going to several different doctors who offered me no answers, no proper diagnoses. They just wanted to do surgery. I also did several stints of different kinds of physical therapy, most of which just made me worse. And I had just about given up all hope. I was at the end of my rope because I couldn't stand it anymore. You know, I might have looked maybe tired or a little depressed to people, but really I had all this screaming pain throughout my body.
Before I came to this center, I was in chronic pain for about 10 years, and I saw many doctors, practitioners, physical therapists, chiropractors, and basically they either wanted to do surgery on me or they'd like to medicate me to mask the pain. So when I first came to the center, I was obviously very skeptical of, was this going to work? Is this really worth the time and energy to put in, and the financial cost of it? Because after 10 years of seeing people and not getting what I needed, the relief, you're weary of different things.
About 4 or 5 years ago, I took a really bad fall. I flew up in the air, landed on the base of my spine. I was very fortunate I didn't break anything, but I knew I had injured it. So it went back and forth, going to the doctor, going back to therapy, and because of the underlying back situation, I knew my doctors often were kind of just throwing their hands up in the air and saying, well, it's probably as good as it's going to get. I didn't want to give up because the pain was pretty severe. So over a period of time, and I mean over a period of like 4 to 5 years, I continued to search for somebody to help me with this because I knew my body and I knew this just wasn't going to go away.
So let's connect the dots to unravel the pain syndrome. As you can see in this picture, there are several pieces to musculoskeletal disorders. Posture and motion is one of them. Circulatory system is the other. The endocrine and the immune system is another component, as is the neurologic component. And of course, there are behaviors, there are individual behaviors that add to musculoskeletal pain syndromes. All these systems interact with each other to form the syndrome. And all these pieces need to be addressed if we're going to have good outcomes with treatment of chronic pain syndromes. The progression of symptoms, over time, obviously the symptoms get worse, and you can see in this chart here that when we talk about chronic pain syndromes, we're talking about more the frequent, the constant symptoms. And the symptoms can vary. It's very individual. Each person is individual, and therefore that symptom complex that we saw in the previous slide with all the different components that interact to form the pain syndromes, that's of course also individualized because the amount of input by each system will vary based on each person, because the type of injury varies from person to person, as well as the compensatory patterns vary from person to person. So as the symptoms progress from occasional to frequent to constant, or anywhere on that spectrum, each person's body is going to compensate in their own special way. And therefore, one of the important aspects of treating chronic pain syndromes is individualization and recognizing what interactions are taking place within each person's body to develop a treatment program for each person. So as we go down this chart, you can see that there is the soft tissue response, and there's the peripheral nerve response, the joint response, the endocrine, autonomic, and circulatory responses. What's important to know is that all these feed into each other. They communicate and compensate with each other. And so as the pain syndromes get more chronic, there is more and more compensation and involvement. And the trick is to break up these interactive syndromes and target each piece of this puzzle and restore each system to its optimal health to resolve the pain syndromes. So you can see down here also, as you go down the chart, how the extensive change in tissue quality can cause peripheral nerve response, and the peripheral nerve response in turn will accentuate the soft tissue response. And both those are going to affect the joint quality and the joint movement, and the joint response is in turn going to feed into the soft tissue response and the peripheral nerve response. And those three are going to trigger the endocrine, autonomic, and circulatory responses, which in turn will feed back into the chronic pain cycle. So just to talk a little bit about the physiology of chronic pain, and of course, I'm not going to go into too much detail. This is a short talk, and the physiology in itself can get very intricate and can be an hour's or longer talk in itself. So I just want to touch up on those components of the musculoskeletal system that are going to trigger other responses and cause involvement of the multiple systems of the body. Now, of course, depending on where you are on that frequency spectrum and chronicity spectrum, there's going to be a varied response amongst all these other systems. And that's where the individualization takes place again. So where the biomechanical system is concerned, there's an activation of type 1 fibers, and there's increased calcium in the sarcoplasm, which is going to affect the elasticity component of the soft tissue. There's ATP depletion and fatigue as the cells get affected, and increased substance P and fibroblasts, so there's a widespread inflammatory response. Now, a reduction in the tissue elasticity is obviously going to cause a pressure on the nerves, as is going to cause compromise in the joint mobility, and also the circulation. It's going to also cause pressure on the blood vessels. There's going to be fatigue, so the endurance factor is affected. The endurance is going to be lowered. And the inflammatory response is also in turn going to cause pressure on the nerves and on the arteries as the tissue gets congested. All these, the soft tissue component and the pressure on the nerves and the arteries is going to cause, and also the joint mobility is going to cause postural compensation. Where the neurological system is concerned, there's repeated firing of the neurons as there's irritability and a pain input. So there's hyperreactivity, there's synaptic fatigue at the neuromuscular junction, and nerve tension and compression. So there's reduced nerve glide, and you're going to start getting symptoms of pain and paresthesias. Of course, that's going to cause autonomic effects as the body goes into fight or flight mode. And gradually, even though it doesn't happen initially, over a period of time, there's going to be a central compensation with shrinking and modification in the central nervous system as well. The cycle continues as the circulatory, endocrine, respiratory systems start getting affected, in the process. So the circulatory endocrine response would cause stress, anxiety, and insomnia, with the triggering of the adrenal cortex and adrenal medulla, which gives rise to increased blood pressure, increased extracellular, start stressing the circulatory system, and also is going to affect healing. Impaired oxygen delivery and increased sugar as part of all these responses is going to cause, again, reduced healing, anaerobic respiration, a reduced activity level, which not only compromises blood flow, but also makes the body more vulnerable to trauma as you start getting reduced muscle strength and endurance and flexibility. And there's compromised lymphatic drainage, which of course overloads the circulatory system, but also causes a reduction in joint mobility. There's reduced chest expansion due to decreased costochondral and sternocostal mobility, and adds to the compromised lymphatic drainage. So now at this point, you see it's not just the musculoskeletal system anymore. Now there are your body's getting affected more systemically. In the presence of all these going on, and I've seen patients in my clinic that have had problems for 10 years or more, by that time you know that all these systems are affected. There's ample compensation that has occurred, and treating just the symptoms is not going to work. Treatment goals. Let's address the problem list. The entire problem list needs to be addressed if you want to treat chronic pain. And what is the problem list? We came up with some of that in the previous slides. One is to restore muscle health and flexibility, reduce the nerve tension, establish normal blood flow, which we need for healing. Lymphatic drainage becomes important to make sure that the drainage is adequate. Postural retraining. In a simple example is the spine. The spine is balanced by the spinal curves in the cervical, thoracic, and lumbosacral areas. And if there is a change in any one of those curves, either due to postural compensation, due to poor posture, or due to tightness and muscle imbalance, or an irritation of the nerves that in turn will cause muscle spasming and tightness. Either way, a compromise in any one of these curves is going to lead a compromise in all the other curves of the spine over a period of time. So postural retraining becomes really important. Of course, it's not possible to retrain posture unless you address the muscle health and flexibility, the nerve tension issues, as well as the joint mobility issues. Breathing exercises become really important, not just for the oxygenation, but also for the mobility at the costochondral and the sternocostal joints. Joint mobility, tissue mobility, as well as neural mobility needs to be addressed, as does strength and endurance. There's ergonomic and work habit modifications, ergonomics not just at work, but also at home. And then, of course, there's the autonomic and behavioral retraining component. Unless all these issues are addressed, especially in chronic pain syndrome, some of my patients have had chronic pain for 10 years or more. In that situation, you know that all these are affected. But again, your problem list will vary depending on the person, the severity of the syndrome, the chronicity of the syndrome, and also how each individual person compensates. So this is a general and complete list of the systems that can get affected in chronic pain syndromes, but there is scope for modification based on individual factors. So based on this philosophy of treating a multifaceted pain syndrome and treating all the facets of musculoskeletal disorders and pain syndromes associated with those, I came up with the Damany integrative dynamic approach. And what is the difference between this approach and other treatments? Firstly, we treat the causes, not the symptoms. So the goal is not just to treat the symptoms, but to target and eliminate the causes for them. With pain syndromes, there are usually multiple causes, and unless all of them are addressed, the relief is simply a temporary fix. Integrative versus focused. So that's where the integrative part of the title comes in. And the approach is holistic. You identify all the areas involved to develop a comprehensive program addressing the complete range of dysfunction. So we're not going to take just one piece of the puzzle. We're going to treat the person as a whole and understand all the interactions that go into chronic pain syndromes, the interaction between the multiple systems of the body. It's not protocol, so that's where the dynamic part of the title comes in. So the program changes as the body changes. So you can't expect that you have a pain syndrome, you identify the problem list, and you decide, okay, this is the treatment plan that is going to take care of this problem list. The problem list will change as the body changes in response to the treatment. So as the body changes, so must the treatment, because the problem list changes. The patient is not boxed into a protocol. Understand that each individual body compensates for injury in its own way, and that several individual factors are responsible for this. Similarly with the recovery, as the body unravels the compensatory patterns during the healing process, the treatment must change to adapt, urging the body into the next stage of healing. Otherwise, there'll be response, and then there'll be a plateau. And if the treatment is not changed, the body is not going to get pushed into the next stage of healing. The approach is long-term versus short-term. When the body heals, the program includes self-techniques to help maintain health and also prevent injuries in the future. This includes activity retraining for day-to-day movements, work, hobbies, sports, any of the goals that the patient may have. And the last is that we are going for resolution. We're not going for management. The body is guided towards healing holistically. The goal is to help eliminate symptoms and keep the body asymptomatic, not simply to manage the symptoms with external aids and activity modification. So the idea is not to say, okay, if this causes you pain, stop doing it, because that's not a cure. So our goal is to resolve the pain syndromes to actually heal rather than just help manage.
And I found Superna, and we started me on the road to recovery, and I will be forever grateful to Superna for her help, because she saved my life.
Because with the touch and the technique that she has, I've been touched probably numerous times by doctors and physicians and physical therapists, and no one has ever had that touch and technique that she has. Because for the first time in my life, I was going to have my life back, which meant I could be me, and I could exercise, and I can run, and I could start a family. Because those are two things that I wasn't able to do when I first came to the practice. I wasn't able to run, and I wasn't able to have children due to the chronic pain.
And my advice to somebody that is living through that is run to Superna. Don't walk, run. And if you can't run, she'll make it so that you can. She'll fix you. I didn't believe that I could find somebody. I kept trying. But she's there, and she will help you, and she will heal you, and she'll change your life.
Takeaway gems. Chronic musculoskeletal pain is multifaceted. Pain causes a disruption of normal physiological interactions between the various body systems. Musculoskeletal changes can include soft tissue fibrosis or scarring, postural dysfunction, neural tension or compression, circulatory and respiratory dysfunctions or disruptions, adrenal and corticoid effects, and autonomic dysfunction, depending on the chronicity and severity. All the above changes are reversible with the correct treatment. Results will be achieved only if all the areas of dysfunction are addressed. Integrative, part of the Damany integrative dynamic approach. Treatment needs to change and adjust as the body responds and changes. Dynamic, part of the Damany integrative dynamic approach. And the Damany integrative dynamic approach, which addresses all the pieces of the chronic pain puzzle, is proven effective in resolution of chronic musculoskeletal pain. I've been treating chronic pain for over 20 years. the Damany integrative dynamic approach is has been developed after 20 years of experience with treatment of chronic musculoskeletal disorders. Chronic pain syndromes are a real concern in today's society. I think as a society, we just take some pain for granted. I mean, don't we all feel like, oh, everyone has some neck pain, or, some back pain is normal and natural, or, if you have pain, you discount it. You think, oh, maybe I slept wrong, or maybe, I traveled and the airline seats are really bad, and oh, I worked a really long day, and you tend to discount pain. And the truth is that pain is not normal, and that you don't need to live with it. And I get a lot of patients in my practice who'll say, oh, I guess I'm getting older. And I always say to them that, aging is inevitable, but suffering is not. And I think that, in this society and with our lifestyles, we are seeing more and more of these chronic musculoskeletal pain syndromes. Not only that, the average age of my patients in my practice is getting younger and younger, and that's really concerning. So this is my contribution. This presentation, my talking about my philosophy and the Damany integrative dynamic approach is my contribution to chronic musculoskeletal pain disorders. I've been treating them very successfully in my practice for over 20 years, and I hope that that more practitioners will start taking this approach. There will be a training manual coming up soon, as well as my book, Chronic Pain Connecting the Dots, and maybe even a course to start training people in this approach. So thank you for your time and attention. If you have any questions, feel free to email me or contact me through my office website, which is damanyhealth.com. That's DAMANY health, HEALTH.com. And I hope this has been helpful, and I look forward to hearing from some of you soon. Thank you.